Lea Castro is a Mexican and Danish national with background in global health, nutrition, and politics. She has experience working for the World Health Organization and is currently working for UNICEF South Africa, focusing on all forms of malnutrition among children and young people. What are disabilities and how do they affect malnutrition?
Hi, my name is Lea Castro from UNICEF South Africa, and I will speak about malnutrition and disabilities. Let me start with a few definitions first. So according to the Convention on the Rights of Persons with Disabilities, a person with disabilities is one with long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. When it comes to nutrition, we have several forms of malnutrition. There is undernutrition, which includes stunting, which is when children are too short for their age, wasting, which is when children are too thin for their height, and we have the other end of things, overweight and obesity, which is when children are too heavy compared to a reference growth standard. Globally, about 1 in 10 children experience some form of disability. When it comes to nutrition, about 22% of children under the age of 5 are stunted, about 7% are wasted, and at the same time, around 6% of children are overweight or obese by the age of 5. This shows how both malnutrition and disabilities are significant global health and human rights concerns. In this video, I will speak about how these two interact and what can be done about this to improve the health and well-being of children globally, as well as specifically in South Africa and in Mexico. So what is the connection between malnutrition and disabilities? These two are very closely linked. Malnutrition can cause or contribute to the development of different forms of disabilities, and disabilities can also lead to different forms of malnutrition. For example, children with disabilities are almost 3 times more likely to be underweight compared to children without disabilities. Several types of disability can be caused by malnutrition. For example, due to lack of nutrients. Every year, globally, about 250,000 to 500,000 children go blind because of vitamin A deficiency, even though supplementation is inexpensive. Disabilities can also be caused through exposure to high concentrations of toxins, for example, to poorly processed cassava root, which can lead to permanent neurological damage. Another example is iodine deficiency, which is a major cause of preventable mental retardation. The early childhood period is a critical window to prevent both malnutrition and disabilities. This is particularly the case in the first 1,000 days of a child's life. This involves the period from conception until the child's second birthday. This period also highlights the importance of maternal nutrition. So if the mother is malnourished or exposed to any additional risks, the child will also be at a higher risk of developing both malnutrition and disabilities.
How can malnutrition lead to disabilities?
While malnutrition can lead to different forms of disabilities, disabilities can also lead to different forms of malnutrition. Some disabilities lead to increased nutrient loss, sometimes to higher nutrient needs, and in some cases to difficulties eating independently. Children with disabilities can also be restricted from proper nutrition because of inaccessibility of water, sanitation, and hygiene facilities at schools and sometimes even at home. This places children with disabilities at higher risk of health complications as well as of malnutrition. Although the main concern for children with disabilities is undernutrition, such as stunting and wasting, Some children with disabilities are also at higher risk of obesity. This is mainly the case of children with restricted physical movement, such as with physical disabilities. On the other hand, there's also evidence about children being denied access to food due to fear of obesity. Some disabilities can also result in direct feeding difficulties. This is the case of children with cleft palate, for example, which might be in need of some form of feeding adaptation or training for caregivers. There may also be feeding challenges for children, for example, with autism, as they may have less interest in food or have uncommon food preferences, which might be difficult to accommodate by their caregivers.
Why are children with disabilities at higher risk of malnutrition?
There are also a number of external factors placing children with disabilities at higher risk of malnutrition. Some of these issues involved inaccessibility of community nutrition services, which can be less frequented by children with disabilities or their families due to difficulties bringing them to these public centers, due to difficulties in access or costly transportation. Children with disabilities are also less likely to benefit from school-based support or interventions because they may not be in school as much as children without disabilities. They can also face a lack of understanding by nutritionists or service providers or caregivers about adequate treatment and adequate feeding. In addition, children and their families with disabilities often face stigma and discrimination. This can lead to isolation among children and families of children with disabilities, which can also lead to neglect, shame, and abuse, and to not receiving adequate care and attention from caregivers, which may include not receiving adequate food. It can also lead to newborns with disabilities to not be breastfed, to receive smaller portions of food, or to not be fed at all. Meanwhile, access to nutritious food for children with disabilities is often overlooked both in the nutrition and in the disability spheres, which places children with disabilities at increased risk of malnutrition. For these reasons, we often see that countries with high levels of malnutrition also have increased levels of disability and developmental delays. What are the consequences of the interplay between malnutrition and disabilities? There are long-term consequences of both malnutrition, disabilities, as well as their interplay. For example, children that are stunted may never attain a full linear growth, and their brains may never develop to their full cognitive capacity. This has an impact on their school readiness, their learning performance, as well as their future life opportunities. Children that are wasted have weak immune systems and are at increased risk of infection and even death. And if they survive, they're more susceptible to become stunted and to long-term developmental delays. This all has implications over the life course and even over generations, as it can lead to a cycle of undernutrition, disability, and worsening health status. Children and young people with disabilities can face various issues such as isolation, exclusion, abuse, neglect, and reduced education and employment opportunities. Youth with disabilities may have low self-esteem and are at increased risk of alcohol and substance abuse, as well as difficulties finding employment. This can all result in both themselves and their household living below the poverty line. This can also lead to a higher susceptibility to develop non-communicable diseases later in life, such as diabetes, hypertension, and heart disease. And particularly in a context of poverty, children with disabilities are often less likely to be diagnosed and to receive treatment when they need it. They are actually more than 3 times as likely to be unable to get the health care they need when they need it, compared to children without disabilities. What do South Africa and Mexico have in common when it comes to nutrition and disabilities? Both Mexico and South Africa are signatories of the UN Convention on the Rights of the Child, which state that children, including children with disabilities, have the right to adequate nutrition. They are also both part of the UN Convention on the Rights of Persons with Disabilities, in which countries have committed to prevent discriminatory denial of healthcare or health services or food and fluids on the basis of disability. Both countries have also committed in their constitutions to guarantee the right to nutrition, including to children and young people with disabilities. And yet, discrimination against people with disabilities is a structural problem in both South Africa and Mexico. Although no recent data is available, approximately 28% of children 0 to 4 years in South Africa experience some form of disability. There are considerable disparities in reported child disability based on age, sex, and socioeconomic status. In Mexico, the estimate is that approximately 8% of children 2 to 17 years has some form of disability. This is equivalent to approximately 3 million children. In Mexico, the most vulnerable are children, women, and people of indigenous populations. Since the COVID-19 pandemic, both South Africa and Mexico have seen an increase in severe acute malnutrition. This is partly caused by food insecurity and financial hardship. Severe acute malnutrition is a form of wasting that is life-threatening and requires immediate treatment. As we know, children with disabilities are already at higher risk of malnutrition and vice versa, thus increasing the vulnerabilities of children, especially in the context of financial hardship. What can be done about the issues related to malnutrition and disabilities? The inclusion of children and young people with disabilities is not only a matter of rights and social justice, but also an essential investment in the future of our societies. It is common to assume that children and young people with disabilities cannot grow and thrive as a result of their impairment. While it is true that some conditions are associated with different growth norms, we also need to acknowledge cultural, social, and attitudinal factors that might be preventing children and young people with disabilities to fully thrive and be included in society. There are a number of actions that countries like South Africa and Mexico can and should take to decrease the challenges between malnutrition and disabilities among children and young people. Overall, political commitment, more resources, and better data are needed. First of all, national legislation and policies, especially on healthcare and social protection, should be aligned with the Convention on the Rights of Persons with Disabilities. Children and youth with disabilities should be explicitly included in the objectives, goals, and monitoring indicators of all development programs. This requires political commitment. Policies, programs, and initiatives must be explicit about and plan for the links and interactions with disabilities at the center. Disability-related messages should remain strong in the nutritional context. For example, national guidelines on severe acute malnutrition should not only mention disabilities, but they should provide detailed, specific disability guidance. Early detection of disabilities and of malnutrition is crucial for their prevention, and also to ensure effective treatment and rehabilitation. Often disabilities are only diagnosed later in the child's life, and malnutrition is only addressed when it's in a severe form. Adequate allocation of resources is needed to make this happen. We know that good data is crucial to achieve meaningful change. Therefore, robust monitoring, reporting, and evaluation measures should be put in place to track the health and care of children and young people with disabilities, combined with referral systems for specialized services. Estimates of disability prevalence should be harmonized by using common definitions and data collection methods, including measures of nutritional status. Likewise, measures of malnutrition should also include disabilities. Finally, the obstacles and barriers to access and accessibility to feeding program and healthcare facilities should be eliminated. This includes specialized training of healthcare, feeding, and any other relevant personnel on disability inclusion and improving service delivery for persons with disabilities to ensure that they have access to the care that they need when they need it. By addressing the interlinkages between malnutrition and disability, we can make a difference in children's lives and ensure that they have the support and the care that they need to survive and thrive.